Number one, this bill contains in it the largest tax increase in American history. This bill contains a surtax which will hit small businesses the hardest. Small businesses in Wisconsin are the backbone of our economy. Most of our jobs in Wisconsin come from small businesses. The top small business tax rate, the top individual tax rate, which is what most small businesses pay, is going up to 45% federally. That means the top small business tax rate in Wisconsin will be 54.27%. This bill also has a new medical tax device, a medical device tax. That means a tax on medical devices that people need, such as prosthetics, stents, artificial hips, wheelchairs, you name it. If it's a medical device, it's going to be taxed. This bill has a new tax on health savings accounts, making them less available to people to use. This bill actually does not allow health savings accounts in the future to be used by individuals who enjoy that kind of insurance now. This bill also has a new payroll tax. It's the same structure as we saw before, which is if an employer does not want to offer the new federally required health insurance for their employees, they will pay an 8% payroll tax, which is indexed at inflation. I have talked to dozens of employers in Wisconsin since July who have told me that if this bill passes, with all the new requirements and mandates that will make their health insurance more expensive, they will dump their employees into the federal exchange, onto the federal plan, and pay this 8% payroll tax. Take a look at the cost of health care in Wisconsin today. Take a look at the fact that in most cases, employers are already contributing more than 8% of wages to pay for employees' health insurance. And so what we believe will happen, and what many actuaries, these are the people who measure these things, tell us, is that anywhere from 50% to 66% of people with employer-sponsored health insurance will lose it, will be forced in the federal government exchange, and the employers will pay an 8% payroll tax. It's far easier for an employer to plan and project what their budget is going to be, knowing that they can just pay 8% of wages indexed at inflation. So for any employer that's going to do this, that means those employees and those jobs with this kind of health insurance will have a 23% payroll tax. That's a 23% payroll tax in America for every person who works at a company that has made that decision. And the actuaries are telling us anywhere from a half to two-thirds of companies will make that decision. 23% payroll tax before you get to paying any other tax. Property taxes, income taxes, sales taxes, you name it. Now, the issue of life is an issue that I get lots of questions about. This bill does allow for the public funding of abortions. This bill explicitly does not contain what we call the Hyde Amendment. The Hyde Amendment language is the language named after Henry Hyde, the famous member of Congress from Illinois, who always put in language, which I tried to do in the Ways and Means Committee, that simply says, no money in this bill can be used to pay for abortions. That language is not in here, and this explicitly allows healthcare providers with taxpayer dollars to fund abortions. Now, doctors' reimbursements. This is another issue. The bill that came before the Ways and Means Committee had what we call the doc fix. If you recall, and we had talked about this throughout our town hall meetings, there's a payment mechanism in Medicare called the Sustainable Growth Rate. This payment mechanism in Medicare is cutting physicians' payments by about 23% next year and cutting it years after that. It is a problem that everyone acknowledges must be fixed. In order to fix that problem in Medicare, it costs about $245 billion. That fix was in this earlier bill. Unfortunately, in order to try and make this bill look as if it is deficit neutral, in order to make this bill look as if it didn't raise the deficit, that doc fix has been taken out of this bill and introduced as separate legislation to pass on its own without paying for it. So that means $245 billion of deficit spending will occur outside of this bill in order to make this bill look as if it doesn't raise the deficit by $245 billion. Now, also, let me talk about entitlements. This is, to me, one of the most important and ill-reported issues surrounding this bill. This bill not only creates a brand new health care entitlement, a new entitlement which, according to many experts, will have on it more people than we have on Medicare in about 5 or 6 years. A new entitlement which means we are subjecting future generations to paying the price tag of a law which I believe will not be paid for. It also expands an existing entitlement. The Medicaid program, by all measurements, is a program that's going broke. It's a program that actually is very difficult for those who are on it because lots of doctors won't even take Medicaid patients. because they actually lose money every patient they take. So Medicaid is in dire need of reform. Medicaid has about a $14 trillion unfunded liability. It is crushing state budgets. This bill expands Medicaid by 50%. So it expands the Medicaid rolls by 50%, in addition to creating this new entitlement, which is what we call this health care bill, the federal exchange. Now, Medicare Advantage is another issue. I remember back in 1999 having town hall meetings at Parkside between Racine and Kenosha. We had a plan back at that time called Prime Care Gold. I don't know if anybody here is from Racine or not, but what we had at that time was a very comprehensive Medicare benefit that people liked. There is a similar program in law today called Medicare Advantage. Lots of people like this program called Medicare Advantage. It's private health insurance that is administered through Medicare. It gives seniors the ability of having all of their Medicare benefits in one plan. So instead of having to go out and buy Part A, B, C, and D, a separate drug plan, a separate supplemental, seniors get one Medicare benefit. It's comprehensive. They get one copay, one deductible, one premium, and it's taken care of. It's been a very successful, very popular program. 216,000 seniors in Wisconsin have it. According to Medicare itself, the chief actuary of Medicare, 64% of Americans on Medicare Advantage will lose their Medicare Advantage under this bill because of the cuts to the Medicare Advantage program. What I believe is behind those cuts to this Medicare Advantage program, because the authors of these cuts have more or less told us this is the goal, is to make the program go away. We have one program that's been successful in Medicare. It has introduced choice and competition. If you recall, many of us have been saying, why don't we convert the Medicare program to work like the program we in Congress have? Let's give them the same access to the same kinds of plans federal employees and members of Congress have, so they have a choice of plans and options. That's what Medicare Advantage is. Medicare Advantage is going away, at least for 64% of the people who enjoy it, according to Medicare itself. Now, liability reform is another issue. There has been lots of talk that we should have medical malpractice reform, because the practice of defensive medicine is one of the key drivers of increased health care costs. I think that call has been heard, but the provision in here that makes it look as if there is something on medical liability reform is really fig leaf medical liability reform. Pilot projects to have some experimentation on medical liability reform only in states that do not cap damages is not medical liability reform. I'll simply cut to the chase. This bill has $500 billion in Medicare cuts to pay for the creation of a new entitlement. It has about $700 billion in tax increases. Tax increases on the middle class, tax increases on people who are just working and trying to survive to get ahead, tax increases on small businesses who are the job creators in America. And it's a $1 trillion spending program at a time when our fiscal situation in Washington is getting out of control. Here is the shame of the Pelosi legislative plan here. Here is the shame of this Pelosi health care bill. We could fix these problems we have in health care without having to do all of this. We can make health care more affordable for Americans. We can make sure that people who are uninsured get insurance. We can make sure that people with pre-existing conditions get affordable health care. We can do that without a 2,000-page piece of legislation, without creating a new entitlement that will bankrupt our country and our children and our grandchildren, without having the government take over the entire health care sector. There are about 40-plus bills that Republicans have introduced to do just that. I've authored a bill called the Patient's Choice Act. Patient's Choice Act doesn't raise the deficit. It doesn't have a massive tax increase. It doesn't have a tax increase. And it gets everybody insured, including people with pre-existing conditions. Problem is, Speaker Pelosi, and she's told us time and again, she's decided to go it alone, along with the President and Majority Leader Harry Reid. One-party rule, that is their prerogative. They did win the election. They decided very clearly, very explicitly, a number of months ago, not to have bipartisan collaboration, to move this bill through. Not simply to fix what's not working in healthcare, but to have healthcare completely taken over by the federal government. I have no doubt in my mind whatsoever that this bill will directly lead to massive budget deficits, will dig our debt hole even deeper, and will lead to the federal government effectively taking over our health insurance system.